Nityanandam. Why mother the mother? A very, very beautiful term, mothering the mother. The whole thing came out when we had some appalling statistics which I would love to share with you now. Looking at the facts of modern day lifestyle, the American College of Obstetricians and Gynecologists concluded that the prevalence rates of depression in the second and third trimester are substantial. Pregnant women with high stress and anxiety levels and with depression are at an increased risk for spontaneous abortion, preterm delivery, low birth weight infants, and having a malformed or growth restricted baby. Very often we find that the head circumference is far below the normal. High pregnancy anxiety during mid-gestation is associated with decreased brain gray matter density in 6 to 9-year-old children. This is an article which was published in the Psycho-Neuroendocrinology Journal, 2010 January. The work was done by the Department of Psychiatry and Human Behavior, the Pediatrics Department, and the Department of Radiological Sciences, University of California. They've done an exhaustive study on 35 women who were categorically proven to have anxiety during pregnancy. This is the summary of the article. Because the brain undergoes dramatic changes during fetal development, it is vulnerable to environmental insults. There is evidence that maternal stress and anxiety during pregnancy influences birth outcome, but there are no studies that have evaluated the influence of stress during human pregnancy on brain morphology. In the current prospective longitudinal study, we included 35 women for whom serial data on pregnancy anxiety was available at 19, 25 and 31 weeks gestation. When the offspring from the target pregnancy were between 6 to 9 years of age, the neurodevelopmental stage was assessed by a structural MRI scan. With the application of voxel-based morphometry, we found regional reductions in gray matter density in the association with pregnancy anxiety after controlling for total gray matter volume, age, gestational age at birth, handedness and postpartum perceived stress. Specifically, independent of postnatal stress, pregnancy anxiety at 19 weeks gestation was associated with gray matter volume reductions in the prefrontal cortex, premotor cortex, the medial temporal lobe, the lateral temporal cortex, the postcentral gyrus as well as the cerebellum, extending to the middle occipital gyrus and fusiform gyrus. High pregnancy anxiety at 25 and 31 weeks of gestation was not significantly associated with local reductions in gray matter volume. Now this was a very, very sad state of affairs in terms of modern living, a lifestyle. We have some more statistics which I'd like to share with you. In the modern era where couples are fighting deadlines at workplace and are under undue stress, a physiological event like pregnancy has been ridden with too many hurdles, starting from conception to delivery. The incidence of infertility is sharply on the rise, ranging between 6-16% almost. 33% of women, that is 1 in 3 mothers, give birth by cesarean section. Incidence of preterm births has increased to 22 to 24% almost. Nearly 20% of all babies born in India are low birth weight. Only 33% of mothers continue to breastfeed their kids at 6 months of age. Postpartum depression affects up to 19% of mothers in the first year after giving birth. Several studies indicate that prenatal and perinatal complications have a significant association with autism and ADHD, which may act in an additive or an interactive manner with the genetic influences to increase the risk. In a country like India, where the Vedic tradition did not have a word equivalent to divorce, marital separation is sharply on the rise. 6 to 7% of all marriages end up in divorce. An alarming 50% of marriages in America end up in divorce. Parenting by itself is a huge challenge with working couples. Now, addressing all these issues is what the End Pregnancy Care program does. A very, very profound program which was given to us in a very beautiful nutshell by Swamiji Paramahamsa Sri Nityananda. a living incarnation, who gave us the gist of this program, which actually addressed all these issues that I have just mentioned to you now. When the program was given to us, he just brought back to our memory the story of Prahalada, the mythological story of Prahalada, a child which was born to the demon lineage. But this child, who was in the womb of his mother, who was a demoness, because of her exposure to some of the most beautiful, profound truths in spirituality, gave some of the best biomemories to the baby. She prepared the body of the baby in a profound manner, staying in the ashram of sage Narada. The whole story has been animated very beautifully and put on the website. And the result of this was, this baby, which was very beautifully prepared by the mother, attracted a high consciousness soul of Prahalada to itself. The outcome was, this baby was a devotee of Lord Vishnu. It had actually defied the demonic lineage from which it was born. Now, this is the extent to which this program can take us. We can choose the genes in the baby prior to conception. We can also influence the genetic expression of the genes when the baby is inside the womb. So in actuality, both the parents are genetic engineers for the baby. It is not just prior to conception. Even if conception has happened, we can actually influence with our perception and the way we handle our lifestyle to actually modify the expression of the gene in the right manner, to bring down a very, very beautiful soul of heightened consciousness onto planet Earth.